Counselor Curtis now.
Please rise.
Dear Lord, we thank you, Lord, for this beautiful day you provide for us. Lord, we ask for wisdom and knowledge as we go through our meetings today. Thank you for the visitors we have. And just be with us as we go through procedures today, Lord. Thank you very much. Amen.
Amen. Shelley, will you call?
Janelle Fulbright.
Here.
Bill England.
Here.
Jack Baker.
Here.
Julia Coates. Jody Fishington.
Here.
Meredith Fraley. Don Garvin. China Lori Jordan.
Present.
Frankie Hargis.
Here.
Chuck Hoskin.
Here.
Lee Keener.
On me.
Dick Lay.
Here.
Curtis Snell.
Here.
David Thornton.
Here.
David Walker-Stick. Sarah Cowan Watt.
Honey.
We do have a quorum.
Thank you. Next is the approval of the minutes. Do we have any additions or corrections to the minutes?
I make a motion to be approved.
Second.
All in favor, signify by saying aye.
Aye.
Opposed, same sign. Minutes are approved. Reports, we have Mr. George Salyers from the Paramore Service Unit.
Good afternoon.
Hello.
Dr. Charles Knife, Chief, has taken over the reins as the medical director and doing a fantastic job. He comes from private practice, many years of private practice. He owned the Northeast Oklahoma Women's Clinic there in Claremore. He had been an employee with us for a couple of years and then went over, and he was employed by Blue Cross and Blue Shield in Oklahoma, and we got him back, so that's a big feather in our cap. All right, the outpatient visits were a little bit down. Down under new services, our MRI, we just Friday we finalized the design on the room that we're going to build around that. We're going to take the east half of our courtyard. If you've ever been in our hospital, you know we have an open courtyard. We're taking the east half of that and dropping the MRI in that courtyard and building around it. That'll go out for bid as soon as we get the final designs back. They said within about a month that'll go out for bid, and hopefully by this time next year, by the end of the calendar year, we'll have an MRI up and running. Inpatient pharmacy, it says work in progress. They finally finished that. It took a little over a year to do that 60-day job. We have moved back in, and things are moving forward there. Collections are up and doing well. Any questions?
Anyone have any questions or comments?
I'm curious.
Yes.
On the MRI, when you said it?
I'm hoping by the end of the calendar year that it's up and we've got patients going through it.
Based on the pharmacy completion?
Yeah. So.
And I have one more question, Madam Chair.
Okay.
On the 2011 level reduction of 1.5%, which I guess my question would be, is it because of the federal funding? It's on page 16 at the top.
On 16?
Yeah, the very top, first paragraph.
That's true.
Yeah. Federal update, appropriations update.
That's Cherokee Nation.
Okay, I'm sorry.
I thought I got a
That's all, Madam Chair.
1.5% cut. I didn't know about.
Councilor Garvin.
Thank you, Madam Chair. I understand one of our companies expanding in Claremore, Hospitality Plus.
I saw
Do you
that.
do a lot of business, or should you do a lot of business with them, or can you do more with them?
We can. In fact, we get extra credit for doing business with Indian-owned, minority-owned companies. The way that works is, and I'm sure they're familiar with this. We put stuff out on Fed Biz Ops. They see that, they submit their proposals, and then that gets the ball rolling there.
It's an excellent company, so I strongly recommend them and help them any way you can over there. I know probably do a lot of, need a lot of their goods, so to speak.
Now, that's the one out on the north end of town.
Mobility Plus. Yes.
See, the bad part about that is that we don't, and neither does Contract Health, pay for hardware like wheelchairs and things like that. But, you know, if we know we've got something out there, our discharge planner can refer patients out there to them with, you know, and a lot of them have resources.
That's good.
You bet, Mobility Plus.
Thank you, Madam Chair.
Council Watts.
Thank you, Madam Chair. First of all, I cannot believe you do not have our signage that we've all worked so hard on noted in the report. But I would like to thank you for your work with your team and the Cherokee Nation Roads Department on getting the signage directing people to the Claremore Indian Hospital at multiple intersections. And it took us 8 years or 4?
Well, it had to be 4.
At least 4, yeah, because you, okay, it was before even, I think you got on board, so I just want to acknowledge that. And then on the referrals to outside agencies, does Mobility Plus just need to come in and visit with you guys to get on the list? And is that the same for the home health services for Cherokee Nation too? Just outline it for us, if you don't mind.
As far as I know, what I'm told that they have to do is go into, and I don't know what the acronym stands for, it's CCR. They go in and register their business on there. They put in their DUNS number, and I can't remember the other name that goes with that. They register in CCR, put their federal ID number and their DUNS number, and that makes them eligible to bid on our contracts, anything that comes up for proposal.
Okay. I know that home health had expressed frustration. I didn't know. So, and then that should be competitive, and there should be a referral process or something.
But we don't pay for home health.
I know, but we don't pay for that other. That's what we're asking. Is like if they're mentioned or something else. Can we get, because that way the record's clear. Because I know Claremore's doing what they're supposed to. Would you mind the indulgence that since home health's here, that would you guys come up and if there's an issue, can we just talk about it and fix it?
Typically for home health, we visit the discharge planner and provide them with information on our services and service area. So as far as the TCR item, I wasn't aware of that.
Okay, so you guys have not completed the CCR deal, so that would probably then open up that process for IHS to appropriately and properly refer people out. Is that the way I understand it?
Well,
even though we don't pay for it.
well, actually, no, because the discharge planner would be the one to take care of that, and he belongs to you guys. He's under behavioral health. He's a Cherokee Nation employee.
Okay, so all air is cleared around IHS then,
From
at
the guy.
Claremore Indian
Yes, sir.
Hospital,
Yeah, he
because
belongs
it's
to
a
you guys.
Cherokee Nation Health Services employee
Correct.
that does that, and that's an internal health issue on our side. Very good, that's what I wanted to make sure was clear, if that was the case.
That's
Okay.
the case.
Thank you. Thank you for your indulgence, Madam Chair.
Councilman Lang.
George, are they building a new IHS clinic or hospital at Miami? Or is that in the works?
Yes.
Will that change any IHS map that my constituents have to put up with at this time? Are they going to draw a new map?
It should. And I'm since they're a tribal facility, I'll go out on. They're a tribal entity up there. They're run and managed by the 7 tribes up there, or 6 tribes in Cherokee Nation. As far as I know, it's not going to change. It's still going to be Ottawa County, or north of the river of Ottawa County.
So that will not influence the same map that we have gotten from you as far as the Claremore IHS map?
No, this should stay the same.
Okay, any more questions for Mr. Valuers? Okay, well, thank you. That's your report. Next is Dr. Gloria Grimm, and I don't see her, but I did see Dr. Skylar Steelberg, so come right up.
Good afternoon, everybody. I believe you have the submission for the program highlights, and Just wondered if there are any questions at this time.
We've got several lined up here, so we'll just go right down the line. Councilor Hoskins?
Thank you, Madam Chairman. We had asked for the policies on implementing the 5%.
Correct.
Those have not been provided to us. We had asked for them.
They have been sent to administration, and we have not gotten them back yet with any recommended changes.
You have sent a draft to someone in administration?
Yes.
You can't speak to the draft at this point? And I don't mean to cut you off, but we're real concerned that the money is there, but it's not going to be spent because this mechanism, which should be in place, is not in place. And
I understand.
The passage of time is hurting our people, and I know it takes time to get these things through, but it is real frustrating that now we're at the next committee meeting after we had asked for it, and if you'd take that frustration back to whoever in the administration needed to hear it, I'd appreciate it, because next month, if there's not something before us, I mean, I'm just speaking for myself, I'm going to draft legislation to say what it ought to be, and that may not go anywhere, but that's how strongly I feel about it. So please impress upon them that we've got to get some guidance on this.
I understand.
Thank you, Doctor. Thank you, Madam Chair.
Okay. Councilor Walker?
Stewart, I was speaking to some of the nurses up at Hastings Hospital, and they were talking about there was equipment that was catching fire during, I guess, like it keeps the blood circulating, I guess, after surgery for, patients. And they said the equipment there is really run down. And we need to get some type of a needs or evaluation put in place where you guys can hear what's needed. Because
we have a biomedical thing in place where everything's on a life cycle. And so we often take things out even before you would actually need to. Yes, hopefully before they catch fire. So I haven't heard about this one. I'm hoping they inform their supervisor. I'm not sure if it's a matter of a cord getting torn up or something. But everything's checked on a pretty regular basis, and it has an end of life that's usually earlier than what the manufacturer would recommend.
When they want to get new equipment, they said there's no money to get new equipment. And we have people's lives in our hands. And so we can't go cheap with them.
I don't think we're going cheap. I don't know where they were in the budget process when they made those requests, because when we're planning for the next fiscal year, we ask for all the requests.
And is there a meeting that's monthly, a monthly meeting that they have where a lot of the doctors and nurses, they kind of get together and they collaborate on?
There are a lot of meetings.
Is there? Okay.
There's QI, there's OR committee.
I can't recall the meeting that I was told, but they said that the administration needs to be present so they can hear some of the concerns that's going on inside the hospital.
As far as I know, administration's present. Someone from administration is present just about every meeting.
I tell you what, when I find out the name of that meeting, I'll shoot you an email.
Sure.
And we need to.
And the equipment.
Yeah. Yes. Okay, that'd be great. I appreciate that. That's all. Thank you.
Councilor Watts?
Yes, thank you, Madam Chair. Along the same lines, it sounds like we're in limbo, but I have constituents that have been denied or continue to be denied under our current system, and they got the news release, all the stories about it. So who exactly do I send them to? I would hate to inundate Brett Hayes or whoever else in Contract Health Service, but these folks believe...
How many are we talking right now?
I easily have 15 or 20 that need to be dealt with.
That's manageable. So I think Brett is probably your first stop. Most likely they're going to meet the guidelines as we plan them anyway. And so I don't see anyone who would meet the need that you're requesting. I don't see them being denied. I don't see any major changes that wouldn't get people covered. So I think, getting those people lined up isn't hard. And if the money's there, so the minor details on what we spend this money on may change, but I think the major things are going to be fine, and I think we can proceed, and I'm not terribly worried about it.
Well, I guess I don't know what that draft looks like.
Right.
So I'm trying to remember, but from the unfunded need, and this doesn't include deferred, so they were approved, but we have no money, so they're deferred. So just in Claremore Indian Hospital, and I don't know how many of these at this point break out, but, well, it is deferred, but we don't know how many are Cherokee deferred. But your year-to-date denials, and I assume we could come back and fund those for immediate need, is easily over $500,000. So, and that's, I assume, just Rogers County and Tulsa probably.
So what, I mean, but what we've proposed so far is we are not going, as far as I understand, and this is where the question may be, is inside the TJSA, but outside our current contract health jurisdictional area. So without looking at addresses, I'm not sure. Also, whenever you're looking at monetary values of cases like that, I need to know if you're talking a Medicare rate, which we pay, or a hospital charge type rate.
May I ask George, Mr. Valier, since he's sitting here,
Yes.
to clarify? So in your report, George, is that rate or is it a different rate?
Those are estimated
Based on,
Medicaid.
okay.
Okay.
So it would be comparing apples to apples. Okay, thank you.
Councilor Fisher-Hawkins next.
Yes, I've requested from Dr. Grimm several times to update us on the status of hiring doctors out at the clinic. Do you know how that's going?
As far as I understand, by March, Jay will be fully staffed. Benita is in the process, the new clinic, of getting its staffing going. We're, I think, looking at Salisaw, and we have started work. We're doing budget estimates on a new salary schedule that we hope will help with recruiting and retention.
Okay. How is it going with drop-in doctors? What we're using at drop-in doctors at Wellman P&J, I get a lot of complaints.
The complaints that were about getting a drop-in or not having a drop-in
They're not
doc?
having one.
The last complaints, I haven't received any complaints from Stillwell in a while. Their main walk-in physician assistant had hurt his back and was out, and they were trying to cover that as best as possible. Which other client did you mention?
Jay.
And I think that was also, they had lost a number of providers, and now that we're getting them back staffed up, I have not heard in the past few weeks any complaints about not being seen there. Has anyone else?
Okay. My other question is the 90-day prescription plan. How's that going?
I know there's been meetings on it, but I'm not sure what's going on. I'm not sure where we are on that.
Okay. And could you ask, pertaining to the question that Councilor Walkenstick talked about, I know in the past couple of years in this committee that we have had debates with the former head of health, Melissa, on how much money was going into equipment. Could you please have her and Gloria send us an amount that we have set aside and carried over for going into equipment at Hastings?
Sure.
And I would like to echo what Councilor Hoskins said. Please pass on that message to Gloria. Several of us have asked to be presented with the guidelines for the 5%.
Absolutely.
Thank you.
Next is Councilor Hyde.
Thank you, ma'am. Doc, are we, how many physicians short are we in our health clinic system?
I don't have the exact number. I'd have to speak with recruiting on that. The Nitas who we're hiring for now, we're trying not to pull too many doctors out of other systems. And since it's not open yet, nobody's moved. Jay was down a number of positions, but like I said, I believe they'll be full by March. A provider just left Muskogee to fill in at, or to take over a spot that was open at Salisaw. And other than that,
Are we one or two short at Salisaw still yet? Or?
yes, we're one down at Salisaw. That would make us one down at Muskogee, I think.
And you say you're recruiting for Veneta. And what I'm afraid of is that large sucking sound we're about to hear when everybody runs up to that brand-new facility at Bonita is going to be all of our clinics combined. Do you have people online that are being recruited at this time?
We're working on that, and as far as I know, I've only seen one actual, that I can think of, I've only seen one actual provider leaving a clinic, leaving Salina, or requesting Salina to go to Bonita. There's probably others, but that's the only one I can think of.
Well, we're not going to have it built until in fall.
Right, so nobody's moving yet anyway.
Yeah.
But we are trying to get those people assigned so that we can start the recruiting process. And I don't know how many, I'm sorry, I don't know how many positions NOADA might be down at the moment.
Okay. We're down, but I guess it sounds like they all are. I'm beginning to wonder how many totally we're down. And it's just a little bit frustrating to realize that we're down everywhere, not just one place. And like I said, when we start filling Bonita, I assume the priorities will be people you have on employment right now or on contract now, where they get the preference for Bonita. And if that happens, I can see us losing more top-end people, physicians, nurses, nurse practitioners, that sort of thing.
Well, we never want to deplete one clinic in favor of another. I mean, some people, especially if they live closer to that one, we'll give them special consideration. But it's not a guarantee that if you request to go to a different clinic, you're going to get to go. We've got to keep all the clinics covered, like you said.
Well, I couldn't blame them to go there. It's going to be the Taj. Chuck's getting the Taj Mahal up there. I keep kidding, joking with him. But it seems like maybe we could do a little bit. We could forecast it a little better, maybe, than we're doing right now.
Well, that's why we are trying to get the assignments done now, well before it's open, so that then we can, the positions are created and we can start the recruiting process to fill whoever we're sending to fill their vacancy, future vacancy.
So I'm 2 down, I think, at NOADA, although one's coming in at the end of this month.
That's my understanding.
We're 2 down at Salisaw.
We'd only be 1 down at Salisaw. Okay. It was a medical director position. It wasn't full-time patient care.
And 1 at Muskogee and 1 at J, or Salina.
Salina won't be until Bonita opens.
So we're at least 3 or 4 down right now.
Probably, yes. That sounds about right.
And how many clinics do we have?
8.
And so half of our clinics were down, and do you have somebody coming in behind them, ready to be hired? Or?
Well, we're recruiting.
Yeah.
As I mentioned before, one of the things we're trying to do right now is we've created a new salary schedule that we hope will make us more competitive. And we're doing budget impact analysis right now before we submit it to administration.
And that's one thing I'd like to see us raise our eyesight a little bit and look down the road a little further, forecast it a little better. It looks like to me we're managing by crisis on these positions, and that concerns me a little bit. That's all I got to say.
Okay, thank you.
Thank you, man.
Councilman Thornton, you're next.
Yes, I just want to re-air something here that Councilor Fishenhoff brought up. And it's getting to be very adamant here with our chair here, Councilor Fulbright, myself also, and that's the 90-day prescription. I know that you all are working on it. This next meeting, I'd like to see a proposal from you all, so we can have some kind of answer for our constituents and our people down there. And, the claims as far as Medicare, Medicaid, I'm sure filing a claim once a month is more expensive than filing it every 30 months. But anyway,
I believe actually that's actually Medicare's rule. 90 days would let us not be able to be reimbursed at all, is my understanding of the situation.
Okay, then I would like to see that. I'd like to see their rule. maybe we could go somewhere and try to get someone to change that. And if we have to go to these congressmen, whoever we have to go to, because it's really hurting our people. And the way, if we're not going to do that, then we need to change the way that we order prescriptions. Because when you call in and by the time you punch all those numbers in and you got 5, 6, 7 prescriptions to order, you're not going to get the right prescription for it it's over with, or you're going to miss one. And then when you miss one, then you've got to wait the next, you may wait 4 or 5 days before you get it turned in, and then your prescriptions are apart. And they come apart every month. You may have to wait 5 days before you can call the other prescription in. And we need something set up where these people can file for their prescriptions and get them all filed for in one day without having to punch all these numbers in for each prescription that falls above your name. And we need to change here somewhere to help our people. And I'd appreciate it if y'all look into this and that you have some kind of report on it next month, because we keep asking for this to be looked at every month. And I don't know if that's also with private insurances that they won't go over 30 days or what, but we need to find out about it. Thank you, sir.
Next is Councilor Hoskins.
Thank you, Madam Chairman. Just briefly back on the 5%. Is it the case that the funding will be retroactive to the enactment of the law, so that you're developing a policy now, once that is in place, you're going to go back and look at folks who were declined, or are only folks that happen to come in when this policy gets into place?
No, I have no problem with retroactive.
Okay. And then secondly, again, I know that Health has done their part by getting the draft out to whoever else in admin, but we really would need to see this in our packet so that we have time to review it.
Right.
Because the idea was we'd get it before it was implemented in case we had any feedback, and we don't want to be sort of pressed up against the wall, so sooner the better. But I appreciate your work. Thank you. Thank you.
Councilor Jordan.
Yes. Can you find out why we're having so many medicines now that our people are having to cut the pills in half? We're ordering pills that are, apparently we're trying to make one size pill do for all people, and if they don't need that much medicine, then we're giving them a little cutter and telling them to cut them in half. Well, I happen to take 2 of those medicines, and I'm telling you, even at my age, you can't get it exactly in half. Half the time, half of it's powder. I've always wondered, since I had to start doing this, well, is the medicine is it equal in both halves? How did we make sure that the manufacturer got the medicine all the way equal across the pill? I just don't understand why we're asking them to cut pills in half. And I even heard from a gentleman the other day that he had been asked to cut his pill into 4 pieces. Folks, we got to do better than this for our people.
In general, I think the rule is usually because whether it's a 25 milligram, a 50 milligram pill, or a 100 milligram pill, the price is the same for each dose. Okay? If we are using a dose a lot, we'll try to have multiple sizes. But
then let's get us a machine that cuts them before our people get them. Have you ever tried to watch an 80-year-old woman try to cut her pills?
I've had to cut my own pills.
My mother had to do that, and that is impossible. And frankly, I'm a little upset about it. I don't mind doing it, but why should we be asking 80 and 90-year-old people to do it? If we really are saving this much money on buying the pills the way we're buying them, then let's buy the machine that goes with them to cut the pills up before our people have to handle them. Giving us a little $1 deal with a razor blade in it and saying, figure out how to get it in that little plastic deal and cut it up where you don't lose half of it to powder. or you don't, I mean, sometimes you get a long half or a short half, or sometimes you get a crumbled up half. That just doesn't seem to make sense to me. And I don't know how in the world you could think we're really getting the medicine we're supposed to get when we're having to do it that way. And I would ask for you to look into that.
Will do.
That we need to bring that to a halt.
Will do.
Okay.
Anyone else have questions?
Yes, Madam Chair. Thank you, Doctor. I just had a couple of comments, questions. Since the government's operating under a continuing resolution, and we're currently operating on 2011 budget, is that correct? Am I reading that correctly?
As far as I understand.
Okay.
I'm not 100% sure on that either.
Okay, so then on 2000...
I'm reading it the same way you are also.
Okay, in 2012 there's a 1.5% deduction. Is that the way you're reading that as well?
That's what I've heard.
Okay. Has there been any steps or measures to accommodate that cut?
I'm not sure.
Okay. And that becomes particularly acute. I mean, it's already voiced here in the committee, the guidelines that we don't have in front of us this time. So if we don't have that and there's a cut, then that will greatly affect our people's coverage and care. So hopefully we will have that next time. And my follow-up question is: are there any new? I read your report, but is there any new initiatives that the health services have come up with this year on their own? I know you're doing a lot of things with diabetes and so forth. Is there any other thing that may be forthcoming for the 2012?
That would have been a better question for Dr. Grimm. I'm just really not sure. We're always looking for new initiatives.
So maybe with the guidelines next time, you could provide us with that information.
Absolutely.
Because I think we all want to support what's going on over there. Thank you, Doctor.
You're welcome.
Thank you, Madam Chair.
Any other questions? Okay, I have one. There have been several. I'm sorry. I wrote your name down. Councilor Garber.
I just want to tell everybody that so-and-so, Redbird Smith, is getting a fantastic doctor, and it's our loss and your gain.
Okay.
Good luck, and we hate to lose her, but you'll really enjoy her. She's a fantastic person.
We're trying hard to get Dr. Dukes, but we're glad
Who is it?
Jamie Dukes.
Brandy.
Brandy Dukes.
Well, you got my doctor over there. Now I gotta go to the scope.
Yes, there have been several ads in all the Square County newspapers advertising the new dialysis center, advertising for patients, sign up and all that. Do you have any? The last time I inquired, I was given the date of May 12th when it might be ready. Do you have any idea?
I heard April or May.
Okay.
We have been getting a lot of phone calls at Sallisaw about that, and we've kind of been directing them to Tahlequah City Hospital.
Well, they gave a phone number, and everybody calls me, and they want to know when the Rhino Center is going to be open up. What a name, but that's an acronym for whatever it is. Okay, it's the Rhino Center. But another thing I wanted to mention, myself and several other counselors would like for us to go back to the 90-day refill system. I know that it might cost a little bit more money, but the folks down in our area are having a terrible time punching in the numbers over the telephone. They don't take voice recordings anymore to get your prescriptions. And according to all my relatives that live around Muskogee, you can call Muskogee at Three Rivers and still give a voice recorded message. You don't have to punch it all in. Is there no uniformity from one clinic to the other how you go about getting your prescriptions filled? And then I am always talking to healthcare providers at the clinics. One lady in particular told me that a lot of her patients come in and their blood pressure will be absolutely sky high, and she'll ask them, what's wrong here? Well, I can't seem to get around to get my prescription filled every month on time, and I'm 3 months, 3 weeks behind. It's a big inconvenience, but there's a difference between inconvenience and the elderly not having the money to go up there, and they are not able to punch it in. the numbers, and they're too shaky. And the numbers are hard to read. It's complicated. I'm not saying that I can't do it, but my 80-year-old sister says she cannot do it, and my 92-year-old aunt, it is out of the question. She cannot do it. So I would just like to see actually how much we are saving, because I know a lot of the people that use the clinics have Blue Cross and Blue Shield and Health Choice insurance. Those insurances reimburse on 30-day supplies. Now, I don't know about Medicare and Medicaid, but we don't totally use Redbird Smith for our prescriptions in our family, and we use a private pharmacy, and Blue Cross and Blue Shield pays for 90-day prescriptions. And I just feel like it's been the wishes of the majority of the council ever since this was started on 30 days to reverse it back to 90. And I would also, as Councilor Thornton says, I'd like to see some progress or a report or something to that effect given to us. I had another question. It was really for Dr. Grimm, but I'm sure you could answer it. On birth control pills, do they only give the ladies a 30-day supply, or do they give them a 90-day supply?
I thought we gave 3 months.
Okay, that's what I wanted to know. Yes.
Thank you, Madam Chair. In your next report, whether it's you or Dr. Graham, that is a good business question to ask. What has been the cost savings on the change? And then if we do go to the 90-day, what will it cost us as well? It may not match up, I don't know, but I'd be curious either way. What did we actually see, and then what do you forecast, or what is actual, both ways?
Can do.
I was told that we were saving $1 million a year by going to 30 days, and I would like to see that, some kind of statistics showing that to me. Yes.
I was told it was 2 or 3 million a year,
Well, I
just
was
the
told
other
it was
day.
1 million.
So
But I would like some facts.
Yeah,
Not
me
really.
too.
Of course.
Any other questions? Then we need to get on with our old business. We have a resolution authorizing the funding of Cherokee Nation Home Health Services, sponsored by Meredith Raymond. Oh, thank you, Dr. I'm sorry. Yes.
I believe on those next two resolutions, Madam Chair, it was my understanding that our new treasurer and our accountant were working on a report to give us on both of the next two resolutions, and we're needing one more month to conclude their work. And so I would ask that those two items be tabled.
Second.
Okay, all in favor? Aye. Opposed, same sign. Okay, table to next month. We have any announcements? Our next meeting is February the 13th at 1 o'clock. We're adjourned.
Make a motion to adjourn.
Okay.
I'll second.